Hey everyone, myself Dr. Amit. I am junior resident in the Department of Radiodiagnosis at AIMS Hyderabad, and today we are going to discuss about a practical guide to MR imaging safety. So we all know that image acquisition in MR imaging is unique and relies on subtle differences in intrinsic behavior of hydrogen protons bound to different soft tissue and fluids to produce a image contrast. This requires use of strong magnetic fields and radio frequency coils, which presents a set of safety challenges distinct from those of all other radiological modalities. MRI is safe, but if something goes wrong, it can go very wrong. One incident occurred in Westchester Medical Center. 6-year-old boy dies of skull injury due to an oxygen tank that came into examination room and it fractured the boy's skull. So this tragedy prompted the American College of Radiology to develop a blue ribbon panel of MR experts including radiologists, physicians, PhDs, technologists and representatives from corporates, FDA and the law professions. So they published the white paper on MR safety in 2002, that is the first document, and which was revised in 2013, forms the basis of current recommendations. MRI safety is divided into implants, quench, contrast, medical emergencies in MRI, RF fitting, sedation, acoustic noise, and projectiles. So we will see one by one. Introduction to magnetic field. So magnetic field can be divided into three parts, that is static magnetic field gradient, and radio frequency pulses. So static magnetic field can cause device, implants, or projectile type of injuries. Magnetic field gradient can cause nerve stimulation or acoustic noise, and radio frequency pulses can cause heating of tissue and thermal injuries. First, we will discuss about the effects of static magnetic field. So, static magnetic field, it is produced by the static magnetic field coils in the MRI, and magnetic field inside the bore is approximately 10,000 to 100,000 times the magnitude on the Earth's surface. These coils emerge in the liquid helium for decrease the resistance, and once established the main magnetic field, it remains on for several hundred of years. So what are the effects? So effects are, it can cause attraction of ferromagnetic materials toward the magnet, can cause the projectile type of injuries, and it can produce biological changes. So biological changes are depends on the magnetic strength. So if it is below 2 Tesla, then there can be increase in amplitude of T waves, no serious cardiovascular effects, and there can be problem with the cardiac gating. And if it's about 2 Tesla, then there can be chances of fatigue, headache, hypertension, irritability. There can be problem with sickle cell anemia patients. So these are the effects of static magnetic field. Now there is a concept called the 5G line, which is given by the US FDA in 2005. This 5G line is the upper limit where the field strength is of no potential concern for the general public. But yeah, it does not safeguard against the projectile incidents. So this line represent that the field drop of about 0.0005 Tesla. So this is the 5G line we should know about. Now let's talk about the projectile injury. So we know that ferromagnetic metal objects can attract toward the metallic bore. So it depends on the strength of the magnetic field, distance from the magnet, and mass of the object. So it is proportional to the strength, distance, and the mass of the object. Now, projectiles can be aneurysmal clips, biopsy needles and markers, bone and spinal fusion devices, cardiac pacemakers, cochlear implants, vascular and cardiac stent if it is implanted 6 weeks, then GI endoclips, hearing aids, heart valve prosthesis, dental implants. This can be the projectiles. So that's why we should always screen the patient before MRI study. So what are the safety recommendations? Installation of metal detector at the entrance of MRI imaging should educating all the healthcare personnel and associated staff about the possible hazards with ferromagnetic material. So for this reason, this is divided into 4 zones. So zoning of MRI complex 4 clearly labeled distinct zones to restrict potential ferromagnetic materials in MRI scanner room. So there are 4 zones and there is access is progressive. So here we have the MRI area in our institute. Here we can see the zone 1, which is given in the blue line. So it is freely accessible to the general public, usually outside the MRI environment. Here we have the zone 2, which is include reception area, patient waiting area, toilet. So here we have the toilet in our department, then nursing station, patient history and MR screening done here. Now zone 3. Zone 3 is the restricted access. So only screen people allowed. Only restricted with the key lock system, pass key locking system or any fingerprint reader. It should be clearly demarcated with the notice. Now here we have the zone 4. So zone 4 is the magnetic room. So it is marked with the red light and lighted sign stating the magnet is on. In line of sight of level 2 MR personnel and MR technologist can go inside. So MR level 2 and 1 MR personnels are given by the CBBI, which is certified by the CBBI. Video cameras to monitor the patient head and equipped with MR compatible resuscitation equipment, and this room is clearly demarcated with the 5G line. Okay, so this is the zone 4. So let's talk about the effect of changing gradient field. Gradient coils produce magnetic field gradient to encode MR signals. So here we can see that here we have the X coil, here we have the Z coil, and this is the Y coil. So rapidly changing current inside these coils produce the microscopic movement, and this is causing the knocking and buzzing, which can cause peripheral nerve stimulation. So this depends on the proportional to strength, speed and duration of the gradient pulses. Activation of the gradient coils can cause the noise, which can cause temporary hearing impairment, and in few studies there is a potential for permanent hearing. In few studies there is a chances that it can cause the permanent hearing impairment. So there is a FDA limit. Without the hearing protection it can be up to the 140 decibel, and with hearing protection it can be up to the 99 decibel. Now, what are the safety recommendations for acoustic injury? So we can use disposable earplugs over the ear headphones, ear defenders, which can attenuate up to 10 to 30 decibel of the sound. Earplugs are must in all neonates, and there are different sizes available for the neonates. We can also do additional passive noise shield and active techniques such as noise minimizing, or we can say silent pulses sequence. So these are the safety recommendations for the acoustic injury. There is one concept called as the magnetophosphine. So in this, what happened? The patient will note unusual visual disturbances during the MR screening. So there can be chances of light flashes or stars in one eye. So it is because of the stimulation of retinal phosphates by induction from changing the gradient field. So this is the occasional phenomena occurs sometime in the patients, which is called as the magnetophosphine. Now let's talk about the radio frequency heating. The biological effect of radio frequency absorption is tissue heating, maximum at the surface and minimum at the center of the body. So FDA limits are: in body core it can be increased up to 1 degree Celsius, in periphery increases to 38 degrees Celsius, trunk increases to 39 degrees Celsius, and extremities increases to 40 degrees Celsius. So these are the FDA limits. There is another concept called as specific absorption rate, and which is depend on the radio frequency energy deposition in the body, and the unit is watts per kg. So FDA limits are for whole body exposure is maximum, that is 4 watts per kg. If more, then sequence will does not start. Rest all other cases 1.5 watts per kg is okay. So these are the FDA limits. Now let's talk about the burns. So burns can be caused by skin contact with the radio frequency transmitting and receiving coils cables. It can be because of contact of the patient's body with the side of bore, and external objects like coiled ECG leads and jewelry can form conductive loop and heat up, and that may cause burn. Transdermal patches contain traces of aluminium, so it's better to remove the aluminium traces, or it should be away from the coil. And tattoos contain rich iron oxide that may cause burn. So what are the safety recommendations? So proper screening of patients, change out of straight cloths, is better to give the gowns to the patient, avoid skin contact, no crossed legs, no arms on the hips, no crossed arms. Insulation between the skin and the radio frequency coil and cable should be there. Don't coil the cables. Keep in a straight line. It's better to keep the lower specific absorption rate whenever possible. Manufacturer provided padding should be there. Eyes and ears on the patient at all times. So these are the safety recommendations for the burn. Now, pediatric MRI safety concerns. So, pediatric age group are vulnerable to anxiety. So, we can give sedation, we can keep mock MRI scanner and accompany family members. There can be motion artifact, so it's better to give sedation, and for acoustic noise, earplugs should be there. Sedation and monitoring is essential for good quality images. So, American Academy of Pediatrics recommends the following standard doses of drugs. Midazolam can be given 0.1 mg per kg and we can give maximum 15 gram, while ketamine can be given 1 gram per kg and we can give maximum 5 doses. Standard fasting interval for elective sedation should be there. After sedation, monitoring should be there. Always check for the patient oxygen level, SpO2 level, it should be always 93%. Monitoring of vital signs, level of consciousness. On the scanning room, resuscitation equipment readily available. Oxygen bag, mask with oral airway, suction apparatus, intubation tubes and laryngoscope should be there. After scanning, post MRI, there should be observation till recover of consciousness and child responding. So these are the safety recommendations for the pediatric age group. Now I told you about the mock MRI scanner. So mock MRI scanner can elevate need for sedation. So it will give stimulation of noise and vibration, familiarize the children with the procedure and can elevate the need of sedation in children up to the age of 4 to 15 years. So acoustic noise in the unit can increase response to acoustic stimuli because of the immature anatomical development of the ear. So elicit autonomic instability in both terms and preterm babies, and that's why earplugs in all neonate is must. So we can give other methods like earmuffs which can attenuate up to 7 to 12 decibel of the noise, and noise protection hood can be given. So these are the safety recommendations for the neonates. Now, pregnancy and MRI exposure. So, as 8, there is no harmful biological effects of MRI in the pregnancy. But FDA recommendations are if non-ionizing imaging like sonography is suboptimal, or if the information to be gained by MR would have required more invasive testing like radiography, CT or angiography, MRI is acceptable. So, healthcare practitioner and pregnancies. So permitted to work in and around the MR environment throughout all the stages of their pregnancy. So healthcare workers are permitted to work around the MR environment. American College of Radiology is recommends that MR is risk free during the pregnancy. No special consideration for both first or second trimester. MR contrast agents should not be routinely provided to the pregnant patient. If it's necessary, we can give. Can MR contrast agents be used in pregnant or lactating mothers? So, gadobutyral contrast agents have been found to cross the placental barrier in primates. No adverse effect to fetus with the gadobutyral contrast agent administration in pregnancy has been reported. There are lack of control studies, but few studies have found that there is increased risk in first trimester. So, ACR recommends use of group 2 agents at least possible dose with well documented risk benefit analysis, and preferably after first trimester. And yes, in lactating mothers, contrast can be used safely. What are the effects of high field MRI? Any magnetic field strength more than or equals to 7 Tesla is to be called as ultra high field. The first system in this range was the 8 Tesla system at Ohio State University in 1998. The first 7 Tesla system with approval as a medical device entered in the market in 2017. See how much difference is. So what are the effects? Effects are, so because of ultra high field MRI, there is increased signal to noise ratio, increased specific absorption rate, and increased physiological side effects like dizziness, nausea, and metallic taste. But the pros on it will give the high resolution scan, and there is a very short time for the scanning. So these are the effects of high field MRI. Now let's talk about the MRI contrast agents. MRI provides excellent soft tissue contrast. Contrast agents are pharmaceutical that enhance the contrast between the lesion and normal structure. Enhancement of the images of contrast between the normal and the diseased tissue increases the diagnostic accuracy. So here we have different types of categories of the MRI agents, and gadobutrol contrast agents are most commonly used. So categories are linear non-ionic, linear ionic, macrocyclic ionic, and macrocyclic non-ionic. So the gadobutrol is in the macrocyclic non-ionic. Okay, so these are some brand names of the contrast agents, but we must know that Gadoviz, that is gadobutrol, is the only contrast agent approved for use in children less than 2 years. Now, what are the adverse reaction to contrast agents? So there can be mild, moderate or severe reaction because of the contrast agents. So mild one are flushing, limited urticaria, sneezing, limited vasovagal symptoms. In moderate, there can be allergic reaction, diffuse urticaria, facial swelling, throat tightness, wheezing, physiological continuous nausea, chest pain, prolonged vasovagal symptoms, and hypertensive urgency. But in severe, there can be arrhythmias, seizures, diffuse edema, and hypoxia. So these are some adverse reaction due to the contrast agents. But one of the most important adverse reaction is nephrogenic systemic fibrosis. So what is nephrogenic systemic fibrosis? So it is occur and characterized by the thickening, induration and tightening of the skin with subcutaneous edema. So it is occur in the patient with the renal insufficiency or patient is on the dialysis. So in severe cases of this reaction, there can be joint contractures and immobility. It can also involve the internal organs. Diagnosis is based on the clinical presentation and skin biopsy. So correlated with the release of free gadobutrol from the biopsy tissue, which is most commonly occur in the non-ionic linear type of contrast agents, then ionic linear, and at last it can be present with the macrocyclic. So majority is because of higher doses and multiple doses of gadobutrol contrast agents in a short period of time. That's why there can be chances of nephrogenic systemic fibrosis. The ACR Committee on Drugs and Contrast Media, the European Medicines Agency, and the US FDA given three categories on the basis of their association with the nephrogenic systemic fibrosis. So there are three groups, that is group 1, 2 and 3. On group 1, which are associated with the greatest number of the cases. Group 2 are very few cases with them, and group 3, which are the newer agents and with the limited data. So in pregnancy, we can use group 2 agents at least possible dose with a well documented risk benefit analysis. Okay. Now, if you are in an emergency situation and if you wanted to ask patient about the normal serum creatinine level, then you can ask few questions to the patients. So you can ask the patient, have you ever been told you have renal problem? Have you ever been told you have protein in your urine? Do you have high blood pressure? Do you have diabetes? Or do you have gout? Have you ever had kidney surgery? So this question you can ask to the patients. If all 6 questions are no, then 94% of the patients had a normal serum creatinine level, and this is the reference article. So these few questionnaires you can ask and you can rule out whether patient is having normal serum creatinine level or not. So what are the ACR guidelines on contrast used in the CKD patients? So in CKD 4-5 patients, if eGFR is less than 30 and patient is on dialysis, then group 1 agents are contraindicated. Okay, group 1 agents are contraindicated. Group 2 agents are preferably given, and after giving contrast, hemodialysis should be necessary. In CKD 4-5 patients, if eGFR is less than 30 and patient is not on dialysis, still group 1 contrast agents are contraindicated. And in other CKD patients, there is no specific precautions. So these are the ACR guidelines for contrast agents in CKD. So next one is contrast deposition in the brain. So because of repeated injection of the linear group of contrast agents, there can be dose dependent signal hyperintensity in the dentate nucleus and globus pallidus. It can occur with the patient with normal renal function and months to years after receiving the drugs. Has not been directly linked to adverse health effects in FDA warning 2017, but yes, because of the repeated use of the contrast agents, there can be chances of deposition of the contrast in the brain. So it can occur with the linear group like gadodiamide and gadopentate. Now let's talk about the implants and MRI. So device safety on MRI was introduced by ASTM, that is American Society for Testing and Materials, in 2005. Current FDA approved labeling for devices are MR safe, which is highlighted in the green color you can see here, MR conditional, that is in the yellow one, and MR unsafe, which is in the red color. So these are the three labelings: MR safe, conditional, and unsafe. And data on majority of the devices are available on www.mrisafety.com. So here we can check the information labeled on the packet of the implants, and we can see whether it is MR safe, conditional, or unsafe. So let's talk about the MR conditionals, so which is highlighted in the yellow color. And these conditionals are: patient can be scanned with MR conditionals like EEG, ECG, pulse or cardiac monitor leads, and MRI equipments like coils, functional MRI response pad. So these are the MR conditionals. MR conditionals used in MR room to facilitate the MRI examinations, and the examples like wheelchair, ventilators, step tools, respirators, anesthesia machine, monitors, power injectors, and IV pumps. So these are the MR conditionals. Intracranial aneurysmal clips also MR conditionals, and excessive magnetically induced forces can displace these implants. So plain CT or radiograph should be performed to confirm whether the clip is present. Certain types of intracranial aneurysmal clips, example those who made up from the martinistic stainless steels, are contraindicated. Clips made up of MP35N, alloy, Finox, titanium, and its alloy are permanently immune to the ferromagnetism. So aneurysmal clips guidelines by ACR. So in aneurysmal clips, specific information should be there for manufacturer, type and model, and material of the aneurysmal clip. If the original package present and non-ferromagnetic or weakly ferromagnetic material is there, then there is no need to evaluate for magnetism. If not, in original package and or properly labeled, tested for magnetic field interactions to assess whether MRI is conditional or not. Obtain written documentation when we are doing the scan of such a patients, and consideration must be given to the static magnetic field strength. So these are the aneurysmal clip guidelines by ACR. Now let's talk about the cardiac implantable electronic devices like cardiac pacemakers, implantable cardioverter defibrillators, implantable cardiovascular monitors, implantable loop recorders, and temporary transvenous pacing. So we should always check, is the device is MRI conditional? If yes, then proceed with MRI. Standard protocol should be there. Pre and post MRI interrogation should be there. Yes, monitoring of the EKG and pulse oximetry, and there should be always staff and equipment presence of advanced cardiac life support. If this device is not MRI conditional, then check for any lead abnormalities. If any lead abnormalities are there, then do not perform the MRI. Consider alternative method such as CT or USG. If there are no lead abnormalities, then check, is the patient is pacemaker dependent? If yes, then proceed with caution, and pre and post MRI interrogation should be there. Okay, program to non-pacing mode, disable therapy for ICD, monitor EKG and pulse oximetry. There should always be staff and equipment for advanced cardiac life support. Okay, temporary pacing wire should be there, and device follow after 3 to 6 months. If there is no pacemaker dependent, then proceed with caution. There is pre and post MRI interrogation should be there. Check for monitoring of EKG and pulse oximetry. Okay, and device follow after 3 to 6 months or 1 week if any changes in the post imaging parameters. So these are the things for cardiac implantable electronic devices. Heart Rhythm Society guidelines. Few cardiac pacemakers FDA approved as MRI conditional and starting in 2011. In 2017, Heart Rhythm Society guidelines are there. They made two
recommendation, that is class 1 and class 2A. Class 1 is strong recommendation where MRI with MR conditional systems only in the context of standard institutional workflow, and class 2 is moderate recommendation in MR non-conditional system perform MRI in the absence of fractured epicardial or abandoned leads.
Now let's talk about the cochlear implants. The internal component of the implants are the active circuit, electrode, receiver's antenna, and stimulator. So these are the components of the cochlear implants. So these components can be interact with the magnetic field of the MRI. So implants made of earlier than 2010 are mostly labeled as MRI unsafe by ASTM standards. So because of the magnetic field of the MRI, there can be movement of implant magnet, there can be patient discomfort and maybe image artifacts. So recently cochlear implant containing an internal magnet that have both US FDA marking as ASTM MR conditional have been manufactured. Historically, cochlear implants we are using before, the internal magnet was removed prior to the procedure and then reinserted. So before we used to have two minor surgeries and there are chances of infections were there. With MR conditional magnets, this is no longer required. A head wrap or splint is often used during the MR imaging and which will give a good quality of the image. After completion of the examination, the splint is immediately removed and external speech processor is reinserted and can be used to check the functionality. So after the completion of the examination, we should always take one radiograph or we can do the palpation to confirm the position of the magnet, and surgical revision occasionally is required to correct the magnet displacement if it's there. So this is the cochlear implant. Now what are the absolutely contraindicated implants for MRI? So cardiac pacemakers with temporary transvenous pacemaker leads or abandoned pericardial leads or fractured leads are absolutely contraindicated for MRI. Intracranial aneurysmal clips that we just discussed, where if there is a martensitic steel as a component, it is contraindicated. Cochlear implants manufactured prior to 2011 are contraindicated. Movable metallic implants piercing anywhere in the body are contraindicated. Patients with suspected to have pellets or shrapnels within the eye are contraindicated. Insulin infusion pumps, drug delivery pumps, catheter with metallic components, these all things are contraindicated. Now let's talk about the orthopedic implants. So there are two major concerns for the orthopedic implants, that is the displacement of the implant and radio frequency heating. So most orthopedic implants that have undergone nailing and plating do not have significant displacement. Heating up to 70 degrees Celsius has been demonstrated in the implants, but there is no any clinical significance. Orthopedic implants that have been properly fixed and are passive can be used in 1.5 Tesla under any setting. So these are some guidelines for the orthopedic implants.
What happened if there is any emergency in MRI? So MRI should be equipped with emergency medical equipment on a crash cart. Medical emergency response should not be conducted in zone 4. So immediately remove the patient from the zone 4 to a designated area where it is safe to provide a medical care.
Now let's talk about the last concept of this session, that is quench. So quenching is the process whereby there is sudden loss of absolute zero of the temperature in the magnetic coil. Okay, so refers to sudden loss of magnetic field in the superconducting magnet due to a rapid warming of the magnet. So this can occur if the cryogenic system fails. So the release of stored energy during the quenching can be hazardous and may damage the magnetic and surrounding equipment. There can be risk for asphyxia, frostbite, and yes, I told damage to the MRI system. So helium gas is vented outside of the building via quench pipe. If we will press the button, it will vent out. If pipe fail, there may be a build-up pressure in the MRI scanner room. So what to do in such event? Open the scanner room, evacuate the MRI scanner room safely and do the oxygen monitoring. So this is the quenching. Let's talk about the conclusion. So in the conclusion, proper training of MR personnel working in the MR suite should be there. They should know about what are the hazardous effects of the ferromagnetic material and should know about the emergencies in the MRI. Familiarity with the missile effect of the ferromagnetic material should be there to everyone. Noise reduction whenever it is possible. Look for radio frequency heating. Communicate with the patients while scanning. Sedation issues like in the pediatric age group, we can solve it by the use of sedation given by the pediatrician or anesthesia, and we should always know about the emergencies in the MRI. Screening questionnaires should be there for the contrast, implants, and allergies and pregnancy. So this is the conclusion and this is the take home message for the today's session. These are my references.
Thank you for watching this video and stay tuned for the next one.